Good morning. Third day. I'm tired. First time for me in Florida. It's hot, it's flat, but I came prepared. I read up on the Florida man. So that was my guiding impression for this visit. But today, as the talk might indicate, maybe we talk about sex education. But I only have 20 minutes, so I probably get it through before DeSantis signs the law banning this topic. Actually, no, we're talking math. So the first question I have to you, and you can write down the answer yourself, and then at the end I tell you you're wrong in one of the later slides. Okay, so Mary Jane goes to a store and buys an eighth of lemon OG. The strain has 23.3% total THC. She rolls a half-gram joint. She takes 3 puffs. So how much THC has she inhaled? Anyone? I mean, like all the other talks over the last few days was all about consumption of cannabis and how much you should take. There was a low-dose talk. Like, can anyone answer? No, you're wrong. And I actually show you the data at the end. Okay, this is a hard one, so let's go for an easier one. So if you want to buy Boba Kush with 20.2% THC for $4.20, or Lemon OG with 23% for $7.10, and yes, these prices are made up because the numbers are funny. Which one gives you more bang for your buck? Because right now, that is what a cannabis consumer buys for, and the industry is trying to sell to the consumer. It's all about the total THC number. Okay, so the less potent THC is actually the better for the bang of the buck. So actually, they shouldn't have bought the higher one. They should have bought the lower one if they just wanted more THC for the same amount of dollars. So this is weird, right? I find this curious, why the industry is doing this. And so the whole talk will be about why are you doing this, why this is wrong, and how can we do it better, as an idea. So here's a summary of what we're going to talk about. I will tell you how cannabis is bought today, why it's wrong, how could we do this better, and I will fight you for it. Like the Florida man who got convicted for assault with a deadly rifle by throwing an alligator through a drive-through window. But actually, that's not efficient, and I'm all about efficiency, so I wouldn't use the alligator. I'm German, I'm kind of a stereotype, I have a PhD in chemistry, I'm German, and I'm all about efficiency. And so my lab does all process optimization, analytical development, and all the other fun stuff of chemistry. But I don't do this alone. We do this in collaboration with other research institutions and researchers. Verdian Science presented yesterday, Mike Tagan, and I'm a good friend with his colleague Linda Klumpers. But I also at this slide, I just noticed that all the speakers from the US, they have private companies, they presented their work, and then all the Canadian speakers, so I'm German but I live in Canada, my lab is there, they all are from universities. The university did this research and so on. So same here, we work with UBC because there it is federally legal, we have the licenses and we're allowed to do this work. Okay. Luckily for you, I'm actually not going through all the hard experiments that we've been doing. So we can skip all the chemometrics and the kinetic studies, and it's more of a theoretical or conceptual talk. Also, as I see a picture, camera back there, you don't actually have to take pictures of this. This is being filmed. I upload this to SlideShare. It will be on my website at some point, and the last slide has all the references. So take a picture of the last slide. Oh yeah, and in Canada, we are licensed to do mushroom and psychedelic research. So I have those compounds in my safe as well, but for another day. So how do we buy cannabis today? If you go in a store, it's all about the total THC number. How much THC by weight percentage is in the flower, in the joint, in the vape cartridge. And that seems to be the number that everyone wants. And everyone seems to be complaining about it because the producer needs to get the higher number, but the testing lab is not giving it. So the producer tries other things, or the testing lab will artificially inflate these numbers just to get the business. And there have been enough articles in the recent memory that showed that the label claim is incorrect, that laboratories are cheating and getting caught for it, that producers are cheating and getting caught for it, and all that just because you need this high number. But does this number actually make any sense, or do we even need this? Because if we think of other industries, do they do that? So in pharma, do they sell by weight? Not really. So actually it turns out 2 of these packages, actually 3 or all 3 packages, have the milligram of the active substance on their packaging, but that's not the one you look at, right? Maybe the melatonin with the 20 milligram right there on the label, but the others, you don't really care about the number, you just know that you need that compound or that drug, not how much. And then the other one, so I like to ask questions and participation by the audience. Which is the best wine to buy? I took this picture from a website, the 10 most expensive wines in the world. So here, I think 4 of them are red and there's 1 white. Which one is the best wine? And all of you are wrong because it's the vodka, it has the most alcohol. If we go by the logic of the cannabis industry, that is the best product to buy when you go in a wine store. And so you already see where I want to get to. If you sell by THC weight, you can't sell the right product. You can't really advertise your product. You can't distinguish your product. Okay. And then the other point is that the total THC number is actually mathematically incorrect. And it's easiest exemplified by a pure crystal of THCA. You might know the total THC number is the THC percentage plus the THC acid percentage with a weight correction because THC acid gets lighter when it decarboxylates. So a pure THC acid crystal has 87.7% total THC. Does that make sense? Can a pure substance be 88% pure? It can't, right? Because you didn't listen in middle school chemistry and in middle school math. You have to correct for the weight loss of the sample. If you subtract weight on the numerator, you also have to do that on the denominator. So this formula actually is corrected, and now it works. Very esoteric, very geeky. Why do we care? Because you're underselling your cannabis. All your cannabis would be bumped up in total THC number if you do the correct math. And here we meet again our Lemon OG and Baba Kush. They bump up by nearly a percent point if you have the higher potency, I'll get to that later, cultivars. Okay, maybe to wake you up, or why do we care? If we sell cannabis by percentage point of THC, and that defines the value, which we did, we scraped websites, online stores of cannabis companies to find out if there's a correlation between the sales price and the THC percentage. And there is. It's about 33 cents per percent point of THC that your sales price increases. So the industry is losing $400 million a year by not correctly calculating. And yes, economists would agree that then the prices would adjust, but anyway. So right now, 400 million. So think of that number because you didn't listen in school and didn't get your math right. All the banned books that here in Canada, in Florida, that they ban all the math books wasn't really helpful. Okay, but there's a bad side to everything because your hemp is hot. And it gets even worse. So I showed you that we work with the university. So we get a lot of co-op students. So these are undergrad students that have to work 4 or 8 months in a company to get work experience, and that counts as credits. So yes, I have students that work in cannabis and get a degree for that. They love it. And they're super cheap because I pay them a good wage, but I get half the wage back from the Canadian government. So the Canadian government sponsors a lot of our research. It's amazing. Like Just think of that. That blows your mind as an American. Okay, so cannabis, you buy flower, you buy it by percentage weight of THC. You buy a vape cartridge, and that is either in percentage weight THC or it is in milligrams per gram. If you buy a brownie, it's a milligram per unit. And if it's a tincture, it's milligrams per milliliter. Like, it's all over the place. Like, you need an advanced degree to just keep track of this. And we had talks this morning and yesterday of how much cannabis to take. And like, how do you square that? How do you have an idea how one correlates to the other? Like, a brownie, 5 milligrams per unit, or a tincture, both ingested, tincture is milligram per milliliter, like, that's a different unit type, right? It's really difficult to keep track of. So, here are some ideas for new approaches. And I'm not saying I'm right. I'm just saying you are wrong. And we have to change this. So my first idea is sell the buzz, don't sell dead weight. So yesterday evening, and for some of you all through the day, you enjoyed some alcohol. And everyone, you should be aware of the idea or the concept of a standard drink. And you know, intuitively, you can drink a larger volume of beer than you can drink vodka or scotch. Because a standard drink is a constant unit of alcohol. So that a large glass of beer and a small shot of whiskey have the same amount of alcohol. So you just correct for the ingredient and you vary the weight or the volume of the product. And so if we take that concept and now call it the standard dank, you could package cannabis by a consistent amount of THC. So now you don't sell an eighth of flower, but you sell a fixed amount of THC. And so your unit packaging might go from 3 grams to 4 grams, it just varies, and you don't actually care about the THC percentage anymore. The consumer won't feel cheated because they get the same amount of buzz every time, or the same amount of THC, and you can now start labeling other things because unit is standardized. And so here, as an example, your edible would be 1 unit of standard dank, and then a joint with 20% flower has 40 units, and it goes up for then vape cartridges and tinctures. So that would be one idea. That is firmly a new recreational world. We just sell you the THC. But we also have a lot of medical presentations. So is there more of a medical approach to labeling cannabis? And I think there is, because you already try. You call it a potency. But it's not a potency. Like 20% weight percent THC flower is not less potent than 25% THC flower. Like, you all talk about the entourage effect and all the other compounds. It's not potency, it's just concentration what you're labeling right now. So can we actually label it by potency? And for that, let's just quickly take a step back and think about, so who of you took their vitamins this morning? Some of you, yes. How much vitamin C did you take? No idea, 1,000 IU. What does IU mean? No one has an idea. So IU means international unit, and an international unit is a measure of effect. It has nothing to do with weight, has nothing to do with concentration, nothing to do with moles. It is purely based on the effect. And it is so that you can compare different application forms, administration forms, that always give you the same effect. So a pill or a tincture would give you the same international units of, or the same effect of vitamin C. So the weight between the two products might actually change, but you always get the same effect. So could we use that in cannabis? So if we call that an intoxication unit, we standardize it and just say that a dose effect is 100 IUs. And if we just think an IU is you get buzzed, and 5 milligrams of an edible make you buzzed, how much is that in a joint? It's maybe a puff. And I'm guessing here because I don't actually consume cannabis. So, but I assume that like a brownie or like a piece of gummy and a puff on a joint is about the same buzz, rightly? So we just define that as 100 IUs between the two products. So now we would sell our products in multiples of these intoxication units. And now it allows a consumer to go from a joint to a tincture to an edible and knows that they always get the same effect. Right? That's all what we're talking about for the last few years, to like standardize the effect. So we could do that with intoxication units. And for CBD, we ramp up the number because the clinical doses for CBD are way higher, so you just hide that underneath it. Because right now, the consumer has to remember that they should take 5 milligrams of THC, but probably way over the 100 milligrams of CBD. So you can just all hide that under IUs. But that's difficult, right? So maybe we should do the work. Like if we want to be medical or pharmaceutical, we should put some effort in. And it can be done because, back to our initial question on the smoking side, I have a robot that smokes joints, and I promise you it's not my colleagues. We smoked cannabis, both high THC and high CBD flower, and looked at how the particle size, so the mil size of the flower that we put in the joint, affects the delivery of THC or CBD to the consumer. And the particle size affects the inhalation massively. We can double the THC delivered per puff by just milling it finer. So our initial question, what does Mary Jane get, can't be answered because we didn't mention in that math question the particle size of the flower. And with that, I don't care if your joint is 20% THC or 25 or 30% THC, the architecture is as important for the delivery as the flower ingredient. Also, the recoveries are really bad. So and that cap is consistent with other literature. About 30 to maybe 50% of the THC that's in the flower actually ends up in your mouth. The rest is just combusted and goes off to other places. So you're wasting a lot. CBD, and I do not understand why, CBD is way more efficient in inhalation. Like more CBD gets transported and the recovery is like quantitative. And I have no clue why that is, but we have a lab and we will get to that in the future. And we can also do that for tinctures. Here, this is a peer-reviewed study we did on a randomized triple-blind, comparatively parallel studies, like all the buzzwords in there. We actually checked how different formulations of CBD in liquid lead to blood plasma numbers of CBD. So yes, you can do the work. So, parting thoughts. I'm not the only one who says that. There are also people from the Emerald Cup. Alex Dixon from SC Labs says that over and over again. You might sell the first product on the THC number, but your returning customers are coming on other factors, like terpenes, like flavors. It's not the THC number. So stop advertising it, or using that as your prime real estate on your packaging. Also, right now, the consumer that has been using for decades, they know the THC number. New consumers don't, and there are way more new consumers than the old consumers. So we can't go with the argument, oh, we can't change it because that's the way it always has been. Well, it also has always been illegal, and we managed to change that, and we have way more potential customers coming our way than the old ones. So maybe we should put an effort in and change it. Yeah, don't sell weight and percentage THC, sell convenience. And just a summary, standard dank is the mass of cannabinoids, and intoxication units would be the resulting effects. And with that, I thank my co-founder, Professor Glenn Samis, and the whole research team that helped me in these experiments and kept quizzing me why cannabis is done this way. And with that, this is the one for the picture with the references. And I made it exactly on time. Thank you very much.